are approaching towards the conclusion of our syllabus. I wish you all luck for your practice. We are still conducting courses further. Who all wish to join can inform us, text me in box directly or call me. Do give us review about how you found this course, and let us also know if we can help you further. So in our concluding chapter, I would like to tell you how your approach should be when a patient walks in. So we have a normal course of getting a case paper done. We have a thorough information about, we should get a thorough information about their medical history. That if you are even practicing trichology, you should get a thorough history of their hair thinning, your trichology, the classification of the hair fall, what type of skin they have, if they are into habits of alcohol and smoking, because these habits hinder in our treatment further. Once they have filled the case paper and they walk into your consulting room, give ample time to consult a patient, try to understand what bothers them. Since how long is the problem bothering them, how it started, if it has aggravated later on, what is the aggravating reason or the causes, what triggers it, so you can identify the problem properly and you can treat it accordingly. Once the patient has opened up and told you all its problem, his or her problem, make a thorough assessment of what your diagnosis to be. See what is the budget of the patient, if he is ready to pay for your treatment that you are suggesting. Explain them what are the right treatment approach you have planned and the options you can give to them. You have to explain that the treatment, we are doctors and not gods. We cannot assure 100% results to them, but you can give a range of percentage assuring them about the results. Like normally I tend to give them between 40 to 70%. That also includes factors like the age, the severity of the problem, and the number of sessions they would need to go through to get the proper results. And they also sticking to their home care regime. So once you identify the problem and decide what treatment you are going to give them, explain in detail how the treatment will proceed, what are the precautions they have to take beforehand and what are the precautions they have to take post-op, and the home care they need to take to get the desired results, what medications in supplement to the treatment you are giving there. Take a written consent along with your verbal explanation, and give one copy of the consent, written consent, to your patient in case they forget, so that they don't even trouble you later on with their call saying, ma'am ye hua hai, sir ye hua hai, or we forgot what had to be done. So you also don't get disturbed in your practice. Also, they have a written copy and they have a reminder about it. Once the patient comes and you have done with the formalities, always do a patch test for local anesthesia and the lasers which you are going to do on them. See the contraindications and the indications and choose your patient wisely. Once into the procedure room, you do all the preparations thoroughly. Let the patient relax on your chair or the bed. After After the patient has agreed to the treatment, once the consent is signed, before you take your patient to the procedure room, see that the procedure room is already well set and hygienic. The bed sheets are in place. Also, your machines are also sanitized. After every patient, see that the tips are wiped with sanitizers or sterilium and or spirit, so you're not infecting another patient from the previous one. You changed your towels or napkins that you're going to use on the patient, the headbands, and also you clean the stuff. Preferably use disposable ones. Once the patient is lying on your treatment chair or bed, you put a napkin around its neck, put the headband, clean its face with cleanser before starting any face treatment, because they have come from outside with dust and bacteria on the face. Without cleansing, if you start, it's going to give flare ups of acne and other problems might arise. So once you clean the area, if there is a need of application of a local anesthesia, apply it and make the patient sit in the waiting room and take another patient. Remove the patient's belongings and keep it aside and prepare for another patient. If there is no application of local anesthesia, like in cases where we do peels and skin polishing treatments, MDA treatments, you can immediately start with the treatment. Even while doing the treatment, explain the procedure to your patient. Try doing it on half side first. I do it that way so that the patient understands what difference you are giving by the treatment. When we do any face treatments, I prefer going from chin area towards the tragus area. I never start it upwards down. That might cause sagging, intentional sagging of the skin. So I give movements from below to up. So I go it directionally upwards. You have to be more careful in the periorbital area, because that's a delicate area. The skin is very sensitive and thin around this area. So you have to reduce the settings to almost 1/4 of what you have set for the rest of the face. You can do MDA treatment very safely around the eyes. In lasers, you have to be very, very particular. We put eye shield, so it's sort of very difficult to do under eye treatments. If you have to do CO2 fractional in the lower trough area, I put a bandage, I stick this eyelids, I put a eye shield on the top, and then I start doing the lower eyelid area. So you have to take utmost care and precaution while treating the periorbital area. So you start from the lower area, go upwards, then give a upward movement for the forehead, and also parallel to the eyebrow. So that applies to HIFU, that applies to MDA treatment, that applies to any laser treatment or RF machine treatment. Once you are done with the half of the face, show a mirror to your patient, let them assess by themselves if they see any changes. Also, you have to explain what changes they should see and if they appreciate it. Like after doing an MDA treatment, they might find the skin smoother, the treated skin smoother than the non-treated skin. After doing an HIFU or radio frequency treatment, they should see a lift in this area, eyebrows, or maybe the smile lines might decrease if you do the treatment properly. After the appreciation, then you ask their permission to do the other side. While treating the area, you should understand and assess how many passes of that machine you should give over that target area. So what is the problem, how much you have to rectify, accordingly how many number of passes you have to give. Now that includes with MDA treatment, or while applying peels, or while giving the passes of lasers. So you have to use proper assessment. Okay, also you have to understand where you have to stop the treatment, where is the end point of the treatment. So while doing your procedure on the patient, you also explain how and what that treatment is, how it is going to affect them, and what they are going to experience after the treatment, and what will the treatment in the due course will progress as. Like if you do the peel, you have to explain the patient that after 2 to 3 days they will see the peeling, they do not have to peel it off. Even though you have already counseled the patient, taken a written consent, but still you can keep on bombarding and hammering them so that at least they forget it. And because you do a part of the treatment, rest they have to take care at home to get the optimum results. So understand your endpoints so that you deliver proper results. After any treatment, you see that you apply sunscreen because the skin has been abraded or treated, and that becomes very sensitive and gets damaged by UV exposure. So apply a sunscreen from your side and tell them that they have to use it mandatorily at home. Call them after 10 days or maybe a week for re-checkup. That increases the confidence of the patient on you. Also, while counseling, the patient will observe your body language, what confidence you have, how much knowledge you have. In today's era, understand the patient has googled everything before he or she approaches you, and they have lot many questions. So you should have the confidence and the knowledge enough to explain their questions and their queries and to satisfy their curiosity. Only then they will keep trust on you. You have to keep on assuring them during the treatment also. After the treatment, your recall will also increase their confidence on you. If you see any complications occurring, sit and discuss with them. Don't deny and don't blame it completely on the patient. Yes, it can be because of the flaw of the error or the mistake of the patient which they have done at home. Maybe they did not abide to all the instructions you have given them, but then just do not put the blame and finish it off. Sit and discuss how you can work on that problem or how you can rectify on that. That will again build the trust and the bonding between you. We are not magicians. Doctors are no magicians. You are not creating any magic. In one treatment, nobody is going to get the desired results. If my problem is very, very minor, probably you can. But no patient is going to come unless it's creating a lot of problems to them. So for minor problems, I don't think they are going to rush unless and until they are very much keen or observant about their problems or very conscious about them. So treatments are not in just one go, and you're not going to create any magic. So they have to be coming to you with realistic expectations. You have to explain them. It will take a number of sessions or treatments for you to give them the desired effect. Maybe not 100%, but to some extent they will see improvement in their skin or hair or whatever problem they have come to you. Rainfall and hair fall. What is the correlation? During normal days, we see that we are losing 50 to 100 strands of hair, but during rainfall, we see that it has increased to up to 250 strands of hair. Now, this occurs because of acidic rain, dirty water, and the humidity in the air, which causes the hair to become brittle and break off. Also, the chemicals and the oil that you apply to the scalp makes the scalp and the hair oily. Above that, the dandruff problem increases in rainy season, which causes an increase in the hair fall. To prevent hair loss, keep your hair dry throughout. Do not even keep it moist. Do not use a hot blow dryer to dry your hair. Use a wide comb to comb your hair. It will cause less breakage. Use a mild shampoo that will not cause irritation to your scalp. Also, eat plenty of nutritious and high protein diet and drink plenty of water. In spite all this precaution, if your hair fall persists, do visit a trichologist.